Welcome back to the Birth Neoterist space. I'm your host, Sabia, and we are continuing some conversations about pelvic health, which honestly, I'm telling you, I would be a pelvic floor therapist if I didn't hate going to school. But
Oh, I hate school. So I'm right there
yeah,
with
like
you.
it's like, oh my God, what, how long?
Yeah.
But I would love for you to introduce yourself in whatever ways feels good to you today.
Yeah. Well, my name is Celestine Compton. I'm a physical therapist with Origin, and I always hated school, but I kept going. I actually think anyway, I'm a physical therapist. I specialize in the pelvic floor. That's my spiel. But
How did you get there? How did you decide pelvic
I
floor?
I picked
I
well,
know
I
that's
picked
like you
this.
have to go to physical therapy and then you
Yeah.
have to specialize.
So because I hate school, I was like I looked online and it was like the recession when I graduated. I was an English major, and so when I finally was like, okay, I'm sick of like being like working at restaurants basically and hair salons, and I ended up Googling like what is a growing field that doesn't mean I have to sit at a desk for 8 hours a day. And physical therapy is one of them. And I was like, all right, well, which ones require less than like, how much schooling do I need to
Mhm.
do this? So that was the ticket. I was like, all right, I can go to. So I went to like I had to get all my prereqs done at like community colleges because I didn't have any science background. Um, and then I got into LSU in New Orleans and went down there. I was down there already. I was living there, and then I
Yeah.
applied and I got to go there. So I'm grateful for that. And that's when I first learned about public health. I had no idea, never heard of it before, and I was like, I remember being in class, and the class of like half bros who are just like waiting to like be the next athletic trainer for the Saints or something, right?
Yeah.
Which none of them will be, by the way. If they're
Yeah.
listening right now, that's not going to happen.
Yeah.
Um, but so I remember us being there and just being like, oh, I could do this. Like I had no issue talking about vaginas, vulvas, poop, peeing. Like it didn't, none of it
Yeah.
bothered me. And I was like, well, it doesn't bother me. Somebody needs to do this. So like I could do this. And that's what I just kind of went. I really started doing it because I was working in orthopedics, just like with people who had back pain and hip pain and knee pain.
Yeah.
And everybody also peed their pants or like, had a prolapse or certain things. And I'm like, wait, why are we not addressing like how are these not connected? And then that's when I started
Yes.
looking more into pelvic floor and being like, oh, it's all connected. And
Especially back pain, hip pain,
right,
like
right.
that whole
And
thing is like it tells a story.
it does. And everybody looks at our body like they're parts, it's like, oh, my shoulder versus my whole body. And it's the craziest
Mhm.
thing. Like, and the pelvic floor is no different. They're like, oh, my hip hurts. I don't have pelvic floor issues. I'm like, there's no world where your hip hurts and you don't have pelvic floor issues.
That part.
Like,
Listen, as a person who has like the tightest hips ever, mankind, like when I go to my pelvic floor therapist and she works it out, and I'm like, oh,
oh, this is
this
what
is what
normal
my
feels
hips are
like?
supposed to
Hold
feel
on.
like. Like this is amazing.
uh,
So I would love for us to talk about pivot into
yeah.
Origin. Tell us about Origin. I know a bit about Origin. I'm a part of Origin. So
Oh, perfect. Yeah. Origin is it's a company that's mission is to make pelvic health the norm, to make it that like it's not this taboo thing that you have to have like be like rich to access or to know about in the first place. Um I who Anyway, it's just I could go on forever about like who gets to know about what and in their body and in their care, and it's just not the average person. And anyway, the
Mhm.
goal with Origin is to change that, just make it so that, oh, this is a part of your body. You should know about this part of your body. People know more about how to reset their smartphones and how to fix their pelvic floor. And that's insane. Because they change smartphones
And
every year,
also too, it's like, especially like I think like one of the things that also is really important about Origin, in my opinion, is like the understanding of like making education accessible, like
Yeah.
making it so that you understand like your pelvic health is not just your sexual health, it's literally the way that you walk, the way that
Hmm.
you move, the way that you poop, the way
Yeah.
that you pee, the way
Which
that you like,
everybody does and you need to do to live. Yeah.
mhm, and
And then
have a
on
good
top of
quality of
that,
life.
yeah,
Like
and it's
everybody
the one
wants to
part of our
poop.
life nobody's allowed to talk about. It's the
Hmm.
craziest anyway. But so the first part is making it more normal, and then secondly making it more accessible because they and that's what the best part about Origin is the goal of making it so that insurance accepted. And if you don't have insurance, it is the out-of-pocket cost isn't going to kill you. You're not like,
Mhm.
putting half of your rent towards an hour with a physical therapist. Um, so that's the goal. And obviously long-term goals are to make it even more accessible to include all populations, include, Medicare, Medicaid, all of it.
Mhm.
We're obviously working on that, but they don't make it easy. We're working on it, but the goal is
It's
to make it,
all a process, right?
yeah,
So with Origin, I know you have some virtual aspects
yeah,
as well as some like physical
yeah, in
in-person
person.
aspects. Yeah.
hmm
So how does that
We
work?
we have we have multiple locations in California and Texas, and we're growing outside of that. But it's it's work, right? It's we're finding out like every state's laws and how where to even put a location because if you're living in LA, you don't know where to put a location in Atlanta. Atlanta's huge.
Mhm.
Like you could be on the wrong side. Like the difference of
Mhm.
being on one side to the other is a 2-hour drive for some people, or commute with like public transportation. So those types of things are real barriers that we're trying to figure out. But in the meantime, virtual is something that we're present in 40 states so far. We're working on getting present in all 50 states, hopefully sooner than later, but it's on we're doing it. And I always I do strictly virtual now. I for a long time I was in the clinic and I was working with patients, and during COVID there was a lockdown. We couldn't see our patients. We couldn't,
Mhm.
I remember being really worried that, oh, I haven't seen this person. I've been doing manual work where they have pain during sex, like whatever issues going on. And I was I was convinced they're all gonna backtrack. They're all gonna backslide.
Yep.
It was like
Mhm.
it's gonna ruin their care, their plans were gonna get ruined. Um, and it didn't happen. Everybody kept getting better. And I didn't touch them for months. And it just changed my whole perspective of
For
pelvic
sure.
health. This shift from do you like what do you need me for? Like, am I just there? Like, what's beneficial and how can I make you the most independent in your care? How do I give you the tools to do what I know how to do? Because I
Mhm.
feel like what I know how to do, everybody should know. We should learn this in health class back in high school. Like this should be
That
common
part.
knowledge.
That
And
part.
yeah, the goal is for it to become more common knowledge and for people to just know their bodies. And so virtual, I think is, I mean, even talk to my mom. She was like, "How do you do physical therapy? But the physical's in the word." I'm just, this is first of all, um, physical is about your body. It's not about me in that role. But the goal is for people to have access. And if for some people, virtual is perfect. It fits into their life. They don't have to find a babysitter. They don't have to leave the house. They can fit it in between their
And
work meetings.
how does a virtual session look, right? Because like I've done
Yeah,
like in-person sessions, right? And like, and that's mostly because like I really love a little manual situation. I really,
yeah. And
right? Right?
that's fair. That's totally fair.
Right?
Honestly,
Like,
there's a part where it's like you deserve to be taken care of, like for somebody to
yeah.
take care of you. And that's what
Exactly.
that
However, I
feels like.
also am like a very virtual person. Like I love a virtual experience. My therapy is virtual. I will hit up my
Yeah,
doctors virtually. Like I love a virtual experience as well. And I think especially virtually when we're talking about access to like rural communities, people that don't, have access, or
yeah.
like you said, like they have to get a care, a care provider for their children and their
They have to get
schedule
to the
is
clinic. They
off.
have to,
Yeah, getting to the clinic. Like, so how
yeah.
does a virtual session usually look? Like what happens?
Yeah, it's what the biggest difference between in person and virtual is it's a team process. Like I'm working with the patient, we're doing it together. And you know, what's great about that is it invites the patient to become part of the healing, right? They have to
Mhm.
like we're assessing it together. We're talking through everything versus like when you're in the clinic, I'm like, oh, what does this feel like when I press here? Or what does it feel like? And now the question is, what does it feel like when you press there? And then it's like this whole different
Mm,
realm of like, and I often tell people who've gone to physical therapy in person, if you think about your session, how much of it do you think you do yourself? Like if you really had to think about, like if tomorrow that your physical therapist didn't exist, it didn't exist at all, it just disappeared, how much of it is impossible for you to do? I mean, how much of it is just a learning curve for you to do? And
mhm.
I would say like 80% of it is a learning curve. I would say like there's 20%, literally there's parts that you just can't reach with your finger because it's just too far
Yeah,
back
it's
there and
just
the angle's
impossible,
not
yeah.
right.
Yeah.
Like there's literally some things that you just can't reach. But then they make a Therawand for that, so
Mhm.
it brings this whole new element. But
And I have one of those.
yeah,
Mhm. I have the whole setup. I have that wand, I have my
yeah,
dilators. Like, I was just talking about in another, session, like, I had my partner do, like, a little
yeah,
pelvic floor
yes,
exam. 'Cause I was
perfect,
like, "Here, feel it out, like, see, like,
right,
what I'm talking about," and they were like, "Oh, this side is, like, definitely more soft than the other side," and I was like,
yeah,
"And you see how my hip doesn't move very well on this side," and that's usually like, you know what I mean? Like,
yeah. No,
that stuff I feel
that's
like is
huge.
so, like, it's so empowering,
Yeah,
right? To know your
yes,
body and like you said, I think there is a difference between, like, a physical therapist saying or pelvic floor therapist saying, like, "This is how this feels to me," but you feeling this yourself and knowing, like, "Oh, before I started my session, it felt like this. After my
yes,
session, it felt like this." Like, it really gives you an anchor of, like, what you're aiming for
yeah,
versus being
yeah.
like, "Well, they said it was good and they said it was bad, but I don't know what it feels
Right, I
like."
don't feel the difference. I don't know whether I'm just trusting, and that's what I think
Mhm,
healthcare has been for so long. It's just like, do what I say, trust what I tell you, and,
mhm.
don't ask questions. I mean, not to be a cynic, but for real, I feel
Yeah,
like it was very much like, the patriarchal system where, like, some old white guy told us how to do something, and that was it. Like,
for
Tito's our name
sure,
for that old white guy. So,
for sure. I would love your opinion on so when we talk about pelvic floor therapy, like one of the things I always emphasize is like one, a lot of people don't know about it. So that's number
yeah.
one, right? And a lot of people don't know about it until they're in, an awful situation. Like I'm peeing on myself,
Mhm.
I'm having these issues, like whatever the case is, and then you learn about it. But then the next step is that then it's like, does your insurance cover it?
Yeah.
Right? And then what does it cost? Like, and also like, do you even have a pelvic floor therapist in your area? Like, there's
Yeah.
like
And
all
do you even
these
want to do
things.
it? Do you really want somebody to go in your vagina, right? Like, how many
Hmm.
times people just are like, that's not for me. I'm not, especially
Yeah.
when I work with people who are like of the baby boomer generation. A lot of them are always like, that's okay. I'm gonna just
Yeah,
get two
yeah,
pens and
for real.
that's it.
For
So
real, right?
there's a
So
lot of barriers.
I would love for you to talk about like when you're thinking about the future of this, right? And I also think like we're at this kind of like apex where insurance companies are wanting to cover more. Companies like Origin are aiming to make it more successful in the way that they model the payment system. But I guess like what do you see the future of pelvic floor therapy looking like, feeling like, the accessibility? What would you like to see?
Oh man. I mean, I would love for my job to not exist, right? Like, I would love for everybody to just know the things that I know and it would just become common knowledge. But that said, I don't see that happening anytime soon. So in lieu of that, I feel like if people, I think it's I think it's just knowing. I want everybody to know it exists because I mean, I went through high school, nobody told me anything, and I didn't even know physical therapy was a job until I googled it. Like, I
Mhm,
just people who know it, and I remember being in school with physical therapists. Everybody that I was in school with was in physical therapy school because they had physical therapy in their high school career, in their college career, like,
mhm, that's how I knew
and that's
about
just
it. Mhm,
this certain population who has access to that, right? And who even knows that in the
mhm,
first place. So, I mean, if I broke a bone, my parents were going to give me physical therapy. Like, that wasn't a thing. They didn't know about it, and also like they wouldn't have
mhm,
afforded it. It would have been like an impossible option. So, and there was other kids. Like, what are they going to take off of work and take me somewhere that not my brother and my other sister? Anyway, so I feel
yeah,
like the goal I have is that I want people to know it exists. I want people to know about the pelvic floor and that their body is adaptable. If something is not working for you, if it's limiting your ability to do something, if you're unhappy in your life with your body, there are things you can do to improve. Like, you don't have to pee your pants every time you sneeze or cough. Like, you don't, and knowing that these things are knowing what normal is and what it looks like, and then understanding that if you are outside of that, that there are things you can do about it. Because I think that you're right. Like, there's so many barriers, there's so many limitations to it, but I'm really hoping that first we can change that. And I honestly, I think it's going to become more and more popular. Like, I think access is going to be better and better. Physical therapy is going to be like Origin's doing it. They're the first ones doing it, but others will also. So there'll be
for
options at
sure.
some point. You'll have like like maybe Blue Cross or Blue Shield or this other company, you're going to have like different court, like,
Mhm.
partnerships. Like there'll be more. So I'm not so worried about access being there because there's a need, and need drives progress, right? So
Mhm.
I think as long as people with vaginal anatomy, women, as long as people keep on demanding it, it's going to keep existing and getting better and better. But
And what
the
and
first
what
step
would
is
you
like just
suggest
making
too,
it
like,
known.
when we talk about that knowing, right? Like, what would you suggest? What are some, like, beginner resources for that? Because even, like, as a
Yeah.
doula, right, like, I feel like, again, so when I was in high school, so my, like, structural leg makeup is just terrible, right? So, like so, like, when I was in high school, like, obviously you have gym and stuff, and I used to tell my teacher, and I remember her, and I used to be like, "Yo, my knees hurt," right? But of course, I'm like 15, 16. She's
They
like,
don't believe you. Yeah.
"You're lying," right?
Yeah.
And I'm like,
Yep.
"No, for real, like my knees hurt." So eventually I ended up going to a doctor. Doctor suggested I go to physical therapy. And then I learned like, because my dad is bow-legged as hell, right? Well, was bow-legged as hell. My mom is knock-kneed, and I have a bit of both.
Oh
So
wow. So
structurally, it's giving like you don't need to be running miles and miles and miles, right? And I told you I worked out today, but I was on a bike, right? Because like me just running, hitting the pavement, not gonna work. Being on
especially
a
with
bike,
knees, yeah.
it's better off, right? But through that situation, I learned about physical therapy. I learned about, like how tight my muscles are, like how to lengthen them, and like, how to wear certain things to move my, because I have like patellofemoral, right? So like
Hmm.
moving my kneecap in a certain direction, like, and I learned it there. So I feel like because again, high school started me in that. Then when I came to
Yeah.
pelvic floor therapy, even though it was new to me, I was like, oh, this makes sense, right?
Yeah.
But like, what would you suggest for people who are not in that situation? Like, where could they start in their education about
Yeah.
just pelvic floor? Like, just like, because even birth workers, I'm a doula, right? And even some birth workers are like, I've never heard about this, and I've had babies, and I've been with people that have babies, and
Mhm.
I've seen, the symptoms of something is not lined up right, but I don't even know where to start.
Yeah. I think one of the first things is I guess knowing what normal looks like. And it's not just normal in terms of like part of it is, yeah, what's your structure? Like what are your joints? What's your alignment? What's your muscle function? Are there any really dramatic like issues that are going on? But a lot of it is also like what is normal bladder habits? What are normal bowel movement habits? What is normal period function? I mean, people are given, you know, starting the pill when they're in high school. So they don't even get to know what their period is like and what that's going on.
That
So
part.
like
Hmm.
knowing about these other things gives you information about what to pay attention to when things go wrong. Because we just associate like something is wrong if I leak. Like things probably went wrong way before you started leaking.
That part.
And
Mhm.
if you were just aware of those earlier signs, you could have done something immediately. You didn't wait until you were 45. Like you could have done it when you were like 17 and been like, oh, hold on, let me retrain this. So I think the biggest thing is yeah, it's just the more you know, it changes your ability to assess when something's wrong. And then
For
once you
sure.
have that information, especially as birth workers, like if your client's telling you, "Oh, I'm peeing all the time," you're like, "Well, you're pregnant. That's normal." It's like, "Well, how much is all the time?" Right? And if you start to
Mhm.
change to be more like, what might be worth considering is maybe you're having a hard time trusting your pelvic floor to actually hold it longer. Maybe it's not about the baby pressing your bladder because you're only, 11 weeks pregnant.
Mhm.
Maybe it's not about space. Maybe it's a hormone shift. Maybe your
Mhm.
ligaments are less supportive, but why are they less supportive for you than for somebody else? Like, why are you needing to go pee every 2 seconds versus another pregnant woman down the street? And I feel like just being able to recognize those subtle changes empowers even other people to say like, "Hey, you peed a lot while we were having lunch just now. Do you need to talk to a physical therapist?" like at a,
Real.
it's
And I
just
think too, like one
yeah,
of the things that like, because also I feel like when you start thinking about the pelvic floor and like your own health and whatever, it can be like, oh my gosh, do I need to know every muscle, everything, or like,
right.
is advice going to be like so much? But like literally, like for me, I have a hypertonic pelvic floor, and like one of the things, like some of the advice that my pelvic floor therapist has given me. has been so like easy. Like for example, like for people who have hypersonic floors, they end up being constipated a lot because they're just like, right. So
Mhm.
like she's like, breathe out your butt. And I'm like, oh, breathe out my butt. Okay. Okay.
Uh-huh.
I'm like, that makes sense to me, right? So like I think too, like,
Uh-huh.
like it doesn't, for people who are like starting this journey of either learning or be a participant
Right.
in this type of healthcare, like sometimes it's just a simple little like mind
It's a
switch and just the
yeah.
awareness of like I'm currently squeezing the fuck out of my pelvic floor.
Yeah, and for
Let me
what? It's
take a
not
deep
working,
breath.
right? It's
Yeah.
still not coming out. So,
Yes. It's amazing.
yeah.
So I
No,
have
I think
one
that's a really
last
good
question for you.
oh,
Well,
yeah.
go ahead.
I was gonna say, I think it's a really good point. It's not I do feel like sometimes, I might be guilty sometimes of giving too much too soon to patients where I'm just like, oh, let me tell you everything because I'm just so excited to have them there and I don't know if they're coming back. You never know, right? You always want to believe
Yeah.
that like they are ready and want to do it. So I'm just like, part of me just wants to be able to give them everything. And it's always a good reminder to be like, you know what? Remi- Ask what's important to them. Like, what do they care about? What do they want to know? And what's their biggest issue right now? Is it hemorrhoids? Like, yeah, I leak and I sneeze and all that stuff, but right now I can't think of anything because I have hemorrhoids and it's driving me crazy. Like, because if that's the issue, then let's go into that. Let's talk about what matters. And then we can go into things as they become relevant, because chances
Mhm.
are things will circle back around. And so I think it doesn't have to be all at once. It can just be like, let me just tackle the things that are really affecting me right now and how can I do something differently about it?
For sure, for sure. I have one last question for you. And so, one thing, so me and my pelvic floor therapist, me and her are real cool because I've been working with her for like 2 years now. And so we talk about different things. We talk about like, yes, it can be like to broaden it a little bit. Yes, sometimes pelvic floor therapy can be really associated to people who are pregnant. But also like for me, I've never had a child, right? For me, it was like fibroid surgeries and complications and things like that. Also for me, it's like being an anxious ass person. And then also for some people, it's very like related to like sexual trauma, different, things like that, right? Like there's stories behind
Mhm.
these pelvic difficulties. So in that process, how are you taking care of yourself? Because I think it's like, of course, the manual pieces that you're doing and the virtual care, but it's also the mental health of of everything and you
Yeah,
learning these things. So like how are you taking
yeah,
care of yourself?
yeah. I think when I was younger and I first started, it would definitely just we just build up. I think you'd hear so many stories and it also like you would just care. You'd be invested. You'd be very much like it's impossible not to. Like you like that person I talked about who didn't come back. Where I'm like, oh, if I just had one more time, maybe I said this the wrong thing.
Mm-hmm.
Maybe that, like, was there something I could have done differently? Because now, are they ever going to try again? Was it just like we didn't click? And like, that's fine.
Mm-hmm.
That's allowed. But like, could they try somebody else at the clinic? Maybe they'd click with this other person and they could get care they needed. So there was definitely a period where I was much more, I guess, susceptible. And yeah, it definitely would take a toll because, you care. And I think I started shifting and being, my mantra for a minute was, I'm not allowed to care more than you. So
Mm-hmm.
like, I will care as much as you care. I'll invest as much as you invest. And so suddenly that changes it to a partnership where I just kind of, when people are ready to share something or when they're ready to do something or push themselves in some way, I'm right there with them. I'm ready to do it. But otherwise, I leave it at the door. I'm just like, it's not, I can't, you know, fix
Yeah.
everything. And
Mm-hmm.
yeah, I found that's really helped me learn to kind of check myself a little bit because it's easy to kind of, I don't know, want to do more
Yeah,
and
going to like I wanna save, I wanna
right.
help, I wanna fix, right? And
Yeah,
like you said, it's like I'm here for all of it. I'm present for all of it, but I can't do more than you do. I can't energetically be in this more than you are, right?
yeah,
Because this is your health, right? And this is a partnership. This is not me fixing something.
right.
It's assisting. and
Yeah.
fixing up, you know, assisting you in your process of healing whatever needs to be healed.
Yeah. And that changed
So,
my whole experience in it. It kind of just made it so, because I would take it home and I would just think about these people that I was like, I don't know if I said something weird, wrong, or if I could have said it different. It
mhm.
just like stuck with me. And I think after that, I kind of, since then, I've been much better able to cope and care
I
for
love
myself, I
that.
think. Yeah.
That's super important because a lot of us, you know, like anyone who's providing care, we go into the work because we love to provide care, right? But we still have to have those boundaries around how we show up, how much
Yeah.
energy we're putting towards something. And sometimes it can be really hurtful when you have so much more energy than the other person. You're like, come on, let's
Hmm.
whatever, right? But we have to also respect where people are.
Exactly. Exactly. And that's what it was coming to terms with like, sometimes people don't come back because it's just too much. Like if you've had pain with sex for the last 30 years and suddenly you learn you can do something about it, like that first acknowledges that 30 years you didn't do something about it, right? And that how does that make you
Hmm.
feel like as a person to feel like, oh, or like then you start to feel about why didn't I know about this? And then it's a lot.
It's a whole thing. It's a
It's
whole
so much.
process.
So I've learned to and also just, not necessarily, it's not about me. I don't take it personally. There's a lot going on, and hopefully I can help the people that I see, and then hopefully the people who aren't ready for it find somebody who, maybe just the vessel, the time, the place, like,
Hmm.
when the best thing about the body is it's always ready to adapt. So if you don't tackle it
That part.
today, you can tackle it in 5 years. It's fine. It's not going anywhere. So
That part. I love that. Well, I thank you for your time, and I thank
yeah,
you for that advice too at the end. I think that's so important for people who are caregivers, like to be aware of how much we're investing of ourselves and when it's helpful and when it's harmful. So thank you for your time. And I'm always
yeah.
going to champion Origin a
Thank
thousand
you so
percent.
much. It was so nice to meet you. Thanks for talking.
Same here.
All right. Take care.